I'm here today with my partner in crime, Misty.
Hello.
And we are talking about GLP-1s. GLP-1s, they're all the rage right now. They're really great medications. They do wonderful things for the body, but it can cost you a lot of bone and muscle loss in the long run if you're not doing it correctly.
Mhm.
And we're here to talk about that today. So now I want to introduce Misty. Misty is, again, she's my partner at the office. She's another nurse practitioner. She has been a nurse practitioner for how many years now?
12?
Yeah, a long time.
I'd have to do the math.
And so she's been a nurse practitioner for a long time. We grew up baby nurses together, but her primary background is in internal medicine. So she has a lot of experience with GLP-1s for use in the diabetic population as well as in weight loss. We are here to talk to those things, and here we go. Start out first with some quizzes about GLP-1s. GLP-1s, if you don't know, they have been around for a very long time. They just haven't been used in the general population with weight loss for as long. Misty's got a quiz that we're going to do.
Does anybody know when the first GLP-1 agonist was released to market?
So I graduated NP school in 2006, and I do remember I came out and I was like, I don't know what this is. And it was it Byjurio or Byetta? Byetta. And that was around, I just remember it being 2006, but it was probably earlier.
2005.
Okay.
And Byetta had a bad a reputation of had a significant nausea and vomiting.
Yeah.
It worked great for diabetes.
It was also a weird injection.
Yeah, it was a weird injection, but I personally never had a patient that tolerated it. So they pulled it and then re-released it as Bydureon, did much better. Now, does anybody know when the first GLP-1 was released for weight or approved for weight loss?
Well, so I opened this practice for, with weight loss and wellness and aesthetics in 2014. And we started at that point prescribing Saxenda, which is the same thing as Victoza. And that
you got it.
Yeah, 2014.
2014. So Saxenda, Victoza, they're marketed for different things, but they are the same molecule. But what year was Ozempic released? That was one of our once weeklies.
Yeah, so an Ozempic, if you don't know, that is the same thing as Wegovy, okay? The Wegovy is the one for weight loss, Ozempic is the one for diabetes. So I do not know that one, Misty, because I was not in internal medicine.
Yeah, so 2017, and I will say that I was reluctant to go with a once per week GLP-1 because we were all used to the dailies, but it was made by the same manufacturer as Victoza, Saxenda. But it was once per week. It had a lot less side effects, but still, was really good at weight loss, bringing down the A1C. So when was Ozempic approved for weight loss?
Okay, so I remember it happening. I know we were in this building when it happened, and that had to be around
2021, and it was marketed under the name Wegovy.
Yep.
Again, same molecule as Ozempic, but the Ozempic is marketed for medical diabetes, things like that, and Wegovy is hitting more toward your weight loss.
But now Wegovy is approved for other things as well. If you're already obese, you can also get approval for, now we call it MASH. And then, what's the other one, Misty?
We've got cardiovascular disease, reducing risk for heart attack, stroke. It significantly decreases the fatty liver, risk for heart attack, stroke, sleep apnea.
Yep, sleep apnea as
well. And it's also been shown to improve PCOS.
Yeah, it's pretty amazing. I love it for PCOS patients. How'd you get any more?
No, that's it.
Okay, awesome. Okay, GLP-1s have gotten good press and bad press, okay? So we kind of talked already about the different benefits of being on a GLP-1. So I think primarily, they were brought about, of course, to help with diabetes, blood glucose control, insulin resistance, and they do a really good job at that. A lot of your overweight and obese population and PCOSers, and even patients that are going through menopause or midlife start to become very insulin resistant. It's a pretty vicious cycle, and that just keeps going around and around and around. The patient can't break through that cycle. So a GLP-1 helps them get control of that, breaks the cycle, and the patient's able to lose weight, which is very, very nice for them. I think that's a wonderful benefit. Helps dramatically with reduction of and suppression of our gut hormones, things like ghrelin. They all go up to our brain and tell us that we are hungry. And so it suppresses those. And I know a lot of my patients come in, and Misty can probably test this too, and they'll say, we just have, like, what is it they'll say? They don't hear the food noise.
Food noise, yeah. Or I'm just not hungry all the time. It doesn't matter how much protein I eat. I'm just hungry, 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 which it also helps with stress eating as well, because increased stress, you have increased ghrelin.
Yeah. So, and the other thing is, it's even now being linked to help with, as far as like your alcoholism, things like that. So a lot of addictive food drinking behaviors, it helps a lot with, because it suppresses a lot of those gut hormones and things. It's also going to slow movement of food through the digestive tract, and that's a really great tool as well. In the fact that it's going to make patients that are overeating get full a little faster and stay full longer. So those are all really, really good things.
Another good thing is there's multiple studies going on right now trying to figure out how it reduces inflammation in the body. A significant reduction in C-reactive proteins in people with autoimmune diseases, and trying to figure out how that works.
Yeah, that is a really, really cool thing. We see that just because we do check CRPs in our office. So we see a great reduction in those with the medication. And then, as we mentioned previously, that they think because of this inflammation type thing, that is what is causing the reduction in heart attacks and strokes. So that was a really cool study that came out a couple of summers ago, I believe. So that's really, really cool stuff. The other side of all of this is access has gotten really, really good, I think, here recently for the GLP-1 agonists. There's been a reduction in price. There's some compounded, that the brand names have come down in pricing. It's gotten a lot more accessible to more people in the population. So that's a great thing, I feel like. But it's also, it can be harmful when they're used inappropriately.
Absolutely.
So we have seen that in our practice, and we've seen the loss of muscle. When you look at a body impedance device, okay, it does a really good job of separating your muscle from your fat. So we can see that really easily when we look at, like, say, our InBody. But you can't really tell the difference very well in muscle and bone. So there's many times, especially in women, that as they're getting more into menopausal age, that they may be losing bone as well as muscle, but we can't tell which one it is. And that's also harmful.
Or with morbid obesity, you will expect to see more muscle loss because of sometimes the body just gets to where there's not but so many places to store fat. So it starts wanting to store it in our liver. We'll have fat deposits in our muscle.
Yep.
And so as that weight starts coming down and that percent body fat comes down, is it truly that you're losing the muscle? Or we know to expect some muscle loss because it's not truly the muscle we're losing, it's the fat deposits within the muscle.
Yep. And the other thing is this, and I don't think I've thought about this until recently, but it can also, with starvation diets, it messes with your thyroid.
Yes.
I mean, it messes with your cortisol levels. There's a lot of different things that can happen if these GLP-1s are not being monitored correctly. And with starvation, there's a lot of downstream effects that can occur. So I know in our practice, we really, really push eating enough. We push hitting your protein goals. And for us, we will use a body composition test to decide exactly how much protein they need based off of their fat-free mass.
And I even give them, this is your bare bones minimum. If you go under here, you're in trouble. Now I'll give them another goal.
This is where I want you to be for optimal metabolism, for optimal fat loss. But I will say, don't go under here or we're going to have problems. And I do that with calories as well, because remember, our body's only job is to keep us alive as an organism. So it's going to protect us. And one of the things it does is it wastes muscle for those into calories and nutrients.
Yeah.
And then your body starts storing more fat. So,
Yeah, and that's true. And I always think about it this way too. Like, the more muscle you have,
mhm,
the higher your metabolism's going to be.
mhm,
As these patients lose muscle, and again, it's going to be expected a little
mhm.
bit, but as they are starting to lose muscle, then the metabolism starts to go
Right.
down. So then we're dealing with trying to prevent the patient from regaining because now
And
they have a
feeling
lower
bad and not
metabolism.
feeling like getting up and doing
Yeah.
anything because your body's starving.
Absolutely,
Mhm,
absolutely. And we also have to think about, hey, yeah, there's going to be a little bit of muscle
mhm,
loss, but going forward, post GLP-1s or
mhm.
post weight loss cycle, how do we get that metabolism back up? And that really needs to be addressed
Yeah,
because that is a devastating thing for a patient to have done all of the hard work and lost all the weight
yeah,
and then regain it all.
right. And, that kind of goes into, once you get to your goal weight, like today, I am my perfect weight for me. I'm happy. I look great in my clothes. Well, does that mean I just stop everything?
Yeah, and that's something that needs to
Mhm,
be addressed as well. Whenever providers are prescribing these medicines, at least refer them to I mean, they could even refer over to I don't want to say gym, what is like a trainer or
mhm,
something like that to
yeah.
continue to progress forward with their weights and keeping the weight off.
Right. And making sure they're not under eating and
Yeah.
getting in that catabolic state. Because, I mean, rarely we won't rebound fat unless we're severely under eating. We have to put those stores back. But our body is made in a way that any muscle that's wasted along the way, that's going to be the first thing to rebound because our body's going to put that back in order to start preparing for the next illness.
Yeah, and I read one study, Misty, and it was talking about how you have to work out harder to maintain a weight
Hmm.
loss than even to lose the weight in the
Right.
first place.
Well, the body doesn't like burning fat. It has to use it takes a lot of energy, and when it wastes it, there's not a lot of nutrients and stuff in there. Stuff it just like environmental toxins and fats and all this stuff that's been locked inside that cell that the body now has to get rid
That's
of.
true.
And
That's true.
sometimes when people don't drink enough fluids, that stuff
Mhm.
hangs around in there
Makes you
longer
feel
and you
terrible.
feel terrible.
Yeah.
So, that's one reason that I really focus hard on preventing weight loss. I mean, I'm sorry, preventing muscle
Yeah,
loss
muscle
as much as
loss.
because if I can keep that basal metabolic rate high or add to it by adding muscle,
Mhm.
then you're going to burn hotter at rest.
And, in addition to muscle loss, the thing is with any weight loss cycle, at the end of the weight loss cycle, you're going to have an increase in those gut hormones
Hmm.
because it's almost like your body's
Hmm.
trying to get you back to that previous weight. It must think it's had cancer or
Hmm.
something like
Yeah.
that, and it's trying to get it back healthy again. So it's going to try to increase those gut hormones and make you hungrier.
Because it wants to pull you back to
Yeah,
that old weight,
yeah,
whether it was healthy or not.
yeah,
Because our body just, once it gets used to something, it wants to hang there,
yeah.
even if it's not healthy.
So I think that's also where
Hmm.
exercise comes in.
Yeah.
You have to build back that metabolism. You have to, because otherwise, I mean, just like the Biggest Loser contestants, like
Yeah.
all that weight's going to come
Hmm.
back on. It's going to come back on. Um, okay, so that brings us more to like our maintenance talk. Then now that we're here and we've talked about the good, we've talked about the bad.
We're at goal, we're at sexy.
Yes. So where do we go from there? A lot of patients will come in and ask us that first thing, actually, because many of them have already been through weight loss
Hmm.
programs and they've already had success and then they've turned around and gained it all back. So, Misty, what is your approach to weight maintenance?
So, if they've had a weight problem for most of their life, or at least a year or more, I recommend once you get to your goal weight that you do a maintenance program for at least a year. So, if you're on a GLP-1, whatever dose got you to where you're happy, you'll do that dose every other week for that, at least that year period. And will also calculate you for maintenance. So, you know exactly where you need to be to
Calories.
maintain and not regain fat.
Yeah, so one of the good things about doing a maintenance for a little bit is just kind of what we were talking about previously, how you'll have an increase in those gut hormones. With that increase in the gut hormones, I've had patients come back and say, I could eat my foot off.
Mm.
Like I cannot stop eating. And that is because they just they abruptly stop that GLP-1. Because no matter what, it's not the GLP-1 that has made you hungrier, being on that medicine that has made you hungrier. It's just your body is trying to get that weight back on.
Especially if you've not been eating the calories you need to and the body feels like it's starving.
Yeah.
Because if you're not eating, even no matter which weight loss medication you use, the body will always try to override a medication because, again, it's thinking evolutionary. It's wanting to keep you alive.
Yeah.
Kind of like the body wanting to pull you back to that old unhealthy weight. The body just gets used to something, whether it's healthy or not. So that the maintenance period allows your body to recalibrate itself to what your new weight should be. So it's not trying to pull you back to that old unhealthy weight.
And now that we're talking about maintenance, I do want to address a few things because as far as like exercise goes, now we're not trainers. We are not trainers.
Nope.
So
She could be,
No.
but no.
Well, I love to work out,
Yeah.
but I couldn't train someone. But there's been a lot of research done on it recently, and I think it's just the weight loss craze in general, and the GLP-1 in general. But as far as recommendations about what you should be doing, we always thought in the past that it was cardio, cardio, cardio. That's what helped us be well. So recent research has not showed that. It showed that the weight bearing exercise is equally as important, maybe even more important, because it's going to increase that overall metabolism.
And it's going to help prevent muscle loss as well.
Muscle and bone.
Yeah.
Muscle and bone. So we really recommend to our patients doing some sort of weight bearing
At
work.
least 2 days. Walking, Pilates, weights.
And with the walking, like I tell patients, I'm like, just get a weight vest because that's going to help actually. It's going to really dramatically improve your bone health. And think about it this way. You've lost all this weight. Your body's not carrying around that load anymore. If you put a weight vest on, it's going to help actually increase that load. It's good for your bones and your muscles.
Yeah. And you want that when you're exercising, let it be at least 30 minutes of your heart rate being elevated or feeling kind of like you're huffing it. That will give you a 2-day boost. 30 minutes with your heart rate elevated will continue to boost that basal metabolic rate for 2 days.
And I mean, and even that in itself, when you're coming off of GLP-1s, exercise is going to continue to work on the insulin resistance issues. Like that's the most effective thing you can do for insulin resistance and diabetes
and preventing
general.
bone loss, especially, as we start getting older.
Yep. And so as far as I don't think for me, and you can probably say this too, Misty, I don't think there's any like right or wrong answer as far as maintenance goes. Because I feel like every patient's a little
Everyone's
bit
different. Yeah.
a little bit different. So we gotta kind of figure out where that patient is and what's going to be best for them in going forward. But maintenance has to be looked at, in my opinion, because if you don't look at it, then you're just going to end up being right back where you started.
Yeah. And some people are long-term use because they have diabetes, PCOS, fatty liver. So some of these more medical conditions besides just the weight.
In closing, so I feel like GLP-1s are a tool. They're not a solution. You have to have it as part of a plan. And that plan has to include some sort of protein goal that's based off of your fat-free mass. Again, we base that off of our biometrics we do here in the office, and that's their minimal protein goal. And then as far as calories, not dipping too low with the calories. If you do that, that's going to cause a lot of other host of problems that we touched on as far as thyroid or cortisol and things like that. what other takeaways would you say, Misty, that they
And
need to
making
remember?
sure, increase your calories the more active you are. You can't just be like 5'7", 5'8", and think you're going to do 1,200 calories.
Yeah.
Your calories need to be based on how much muscle you have, how much bone you have, how tall you are, how active you are. That's why it's so important to see someone that can really see you as more than just poundage.
Yeah, agreed,
Mhm.
agreed. And so I think too, always remembering that whenever we see patients and different people come in along their life cycle, trying to meet them where they are. Also with, your plan if you are 18 is going to be completely different than
Right.
someone who is a woman that is going through menopause.
Mhm.
Um, a lot of times you can dip calories a little bit lower when you're
Mhm.
18 and 20s, and you will lose and lose effectively
Yeah.
where you can't do that when you're
Mm-mm.
older. So taking all of those factors into consideration, I
And
think
other
is
health
super important.
problems that you may have as well.
Agreed.
Mm.
Agreed. So we will welcome all questions in the comments. Any last words you want to say, Miss?
I don't think so.
Okay. Thanks, guys. We're really glad you tuned in. Talk to you soon.
All right,
Bye.
bye.